Hi, everyone. Thank you for joining us for this MRCC Medicaid Minute, the Medicare edition. My name is Dina with Missouri Rural Crisis Center, and I'm joined today with Dr. Ed Weisbart as our expert here. We have been getting a lot of questions as the open enrollment deadline for Medicare comes up here just around the corner on December 7th. And people had questions about, what they should choose, what's going on. They've heard program updates from us in the past about this, so we wanted to join for a quick update on what's going on with Medicare. And we're thrilled that you could join us today, Dr. Weisbart.
Well, I thank you, Dina. It's nice to see you.
Dr. Weisbart is a retired family medicine doctor, and he now serves as the Consumers Council, as the president of the Consumers Council for Missouri, as well as being the Missouri chair and a national board member for physicians for a national health program. So he's our go-to expert for things on Medicare. Let's start really quickly with a question about Medicare Basics. So what is the difference between traditional Medicare and a Medicare Advantage plan?
Yeah, they have the same word in the name, but other than that, they are dramatically different. So traditional Medicare is what we also call Part A and B. It's the part that was created 50 years ago, and that pretty much all seniors and people with disabilities you either age in or you have other ways to get in, but everybody has access to that starting at age 65. And it's as simple as it sounds with Medicare, traditional Medicare, Part A and B. We've paid into our taxes for it, and then when we age into it or become disabled, then we can go to almost any doctor in the country and almost any hospital in the country, and Medicare simply pays for it. So there's some issue with copays and deductibles on Medicare Parts A and B, and so most seniors who can afford to purchase a Medigap policy just to supplement their traditional Medicare. But purchasing a Medigap policy, you still have traditional Medicare. So it's as simple as it sounds. Part A and B, traditional Medicare, you go pretty much wherever you want, and Medicare pays for that. There's been an emerging thing now that has roughly half of people in Medicare have chosen not to do it that way, but instead to go into Medicare Advantage. We see the ads on television, and this is something that if you choose to, you can sign up for. And roughly half of people in Medicare today have chosen to sign up for this. And then it's quite different from what I just described. Instead of having your healthcare bills paid directly by Medicare, now Medicare pays an insurance company like United or Humana or any of the ones we see advertised. And then the insurance company pays your doctor and the hospital for you on your behalf. So the problem with that I see primarily is the insurance company is, it's looking out to make its most money. And the way the insurance company makes the most money, of course, is by either getting in the way of your healthcare, directing you to a smaller list of doctors and providers, or just in some way sort of gumming it all up. They have tremendous overhead. So we waste actually a lot of extra money on their overhead. In traditional Medicare, as I said, you can go to wherever you want, and Medicare seldom, if ever, gets in the way of that. Medicare Advantage is where you start to run into needing to ask permission, needing to ask for prior authorization, needing to check the list of which doctors are in or out of network, which hospitals are in or out of network. That's all unique to Medicare Advantage and is not part of traditional Part A and B Medicare. And you may not even see that until you get really, really sick. And then that becomes really, really important to you. People choose to go into Medicare Advantage because then they don't have to buy Medigap. They don't have to buy a supplemental policy, which might cost roughly $200 a month. So it's not trivial. They don't often have to buy a pharmacy benefit, which is another $25 to $50 a month. So a lot of people, when they turn 65, are looking at Medicare Advantage, seeing that they don't have to buy a supplement, they don't have to buy a drug benefit, and there's often no premium. And so they think, well, I'm gonna do that. And if I get sick, I remember what Dr. Weisbart told me on that MRCC call. I remember that. And if I get sick, I'll just leave and go back to traditional Medicare. And what seniors don't know, very, very few seniors know is that when you've been in Medicare Advantage for 12 months and you try to go back to traditional Medicare, you can do that, but the Medigap policies are not required to sell you a policy anymore. So if you are in Medicare Advantage for 12 months and you decide that you're running into these prior authorizations, you're running into they're not covering this doctor that I want or that hospital that I want. If you run into that after 12 months and you say, enough, I'm going to do what I heard them talk about, and I'm going to go back to traditional Medicare Part A and B and get out of this Advantage thing, you may be trapped. You may not be able to. And of course, that happens when you're the most sick and most desperate. So my advice, if you can afford to buy a supplemental policy, is to avoid Medicare Advantage. It's just, you're asking for trouble down the road.
Yeah, it's a shiny package that can be misleading, I think. So if people during enrollment want to make sure that they're staying on that traditional Medicare program, what should they be choosing?
Yeah, you have to be careful because they seem to intentionally hide this from you. So you don't want to choose. My advice is to try, if you can, to avoid going into something called Medicare Advantage or Medicare Part C. That's a synonym. So if you have traditional Medicare, you want Part A and B, and then you want to get a supplement, which is typically Plan G is what people go for. So Plan G is good. You want to get a supplemental policy of Plan G and probably a drug benefit, D for drugs. So you want to do those things. If instead you're looking at one of the options that says, hey, you don't have to pay anything and we're going to give you free eyeglasses and dentistry and we're going to give you free this and free that, you're probably getting tricked and suckered into this other thing called Medicare Advantage. And it may work for you, for a while. And not all Medicare Advantage plans are terrible. You just can't tell them apart. You just can't tell them apart. So it may work for you for a while, but then when you get sick, the sicker seniors are, those are the ones who most want to get out of Medicare Advantage and go back to traditional Medicare. And unfortunately, those are also the ones who find it the most difficult because the supplemental policies are less willing to even sell you a policy.
That makes sense. One of the questions we've gotten a lot this last weekend was from folks about the REACH program. So we actually had talked to you a little earlier in the year about the REACH program. And now it feels like it's very soon and going to be a timely problem. So could you talk to us a little bit about what the REACH situation is, what that timeline and plan kind of looks like?
Sure. So Medicare open enrollment ends December 7th this year, but January 1st of 2023, this new outfit starts up called ACO-REACH. It's a new program from Medicare. Medicare Advantage, you kind of have to pick. You see the ad on TV and you say, hey, I'm gonna go hunt that out and I'm gonna go sign up. I'm personally gonna sign up for that. The new ACO-REACH program is completely different. Medicare is assigning seniors to one of these outfits without telling you in a clear, sensible way, and certainly without asking your permission. So it's happening to it's happening to people only in traditional Medicare. So remember, people in traditional Medicare, Parts A and B, are the very people who said, I don't want a middleman in my healthcare. I don't want an insurance company in my Medicare. So I'm going to stay in traditional Part A and B Medicare. Well, fine. The insurance companies and venture capital and private equity companies figured out that they wanted a piece of that. And so they've gotten Medicare effective January 1st, 2023 to start assigning seniors who are in traditional Medicare into one of these new outfits with a financial middleman so that Medicare no longer sometimes pays your bills directly, but Medicare will be paying these new middlemen to minimize how much care you get. These new middlemen in traditional Medicare make more money the less health care you get. They make more money the less health care you get. And, that is a radical transformation of traditional Medicare. It violates the promise that Medicare made to us all of having reliable access to unfettered care like that. And most surprisingly, I mentioned it happens without your approval. It's happening without Congress's approval. The way this is being set up, doesn't require Medicare to even tell Congress that they're doing this, and certainly doesn't require Congress to approve this. So this is happening without your approval, without your knowledge, and without congressional approval or knowledge. It's outrageous, but it's on track. Medicare has said publicly that they intend to have 100% of people in traditional Medicare switched to one of these outfits by the year 2030. So it's rolling forward unless we stop it.
So I have two questions. I guess the first is, people obviously are concerned about that. That's why we're already getting questions, worried that it's already happened. But if they want to check in January to see if this has happened or try to undo it, what does that look like?
Yeah, that should be a really easy thing to do, but it's not. So I tried personally calling 1-800-Medicare to see if my doctor was in one of these things. There's a previous version that's live today. So I tried calling 1-800-Medicare to see if I've been assigned to one, and they have no idea what I was talking about. I went up 2 ranks and supervisors on that phone line. They have no idea. They've never heard of this. So calling 1-800-Medicare, I don't think is a way to find out. So ask your doctor if they're in one of these. Chances are your doctor's never heard of it, even if they're in one, because remember, most doctors today are not sort of the solo practice anymore. Some are, of course, and then they would make that decision. Most doctors today are in some sort of a larger group where there's a business office that makes these kinds of decisions. So if you call your doctor and say, hey, am I in one of these because of you being my doctor? There's a really good chance that they don't know what you're talking about. So they'll tell you as the right answer, which is call their practice's business office. Well, that's not an easy thing to figure out how to do. And it's probably not everybody in the business office that even knows it. So it's really hard to figure it out if you've been assigned to one of these. And at the end of the day, there's not a whole lot you can do about it. What can we do about this? Well, obviously, my proposal would be we would terminate the program. We need to end this. This is the corporate takeover of traditional Medicare. We need to stop that. That's one thing we can do. But the only real way that Medicare says, if you ask Medicare, how can I get out of this? You've assigned me to one and I don't like that. How do I get out? Medicare's answer, and we've had conversations with them, Medicare's answer is not a problem. You can get out. Just pick a new primary care doctor. That's just outrageous. It's just outrageous for Medicare to be telling their members, go pick a new primary care doctor if you don't like what we're doing. That's not right.
And in a year or two, they'll probably have that doctor on the program.
Right. Crazy.
What can people do to take action? I mean, I think, you pointed out that Congress doesn't know about this. I think they're trying to do this without a lot of congressional awareness because Medicare is incredibly popular. It is vital for the health and safety of Americans everywhere. It is especially a huge security net for our rural communities. So what can people do to help us stop it?
Yeah, there's actually a lot you can do. The first thing I would say is go to protectmedicare.net. Go to protectmedicare.net. And we have a robust suite of tools. We've got, don't just believe, I heard Dr. Weisbart blathering about this. Don't just settle for that. Go to these resources where you'll get all the information. You'll get summaries. You'll get the primary information. You'll get nice little one-pagers, videos, more recordings, a lot more information. There's a petition you can personally sign. There's a petition you can have any organization you're with sign on to, a church group, a union. There's petitions that for individuals and for organizations. And there's draft letters you can write to your members of Congress, your U.S. representative and your U.S. senator. There's templates to help you get started on writing op-eds and letters to the editor. The key strategy to stopping this is to get people to know about it. People don't know. I'm impressed that you asked this, Dina. I'm glad you did. But this is on track to take over all of Medicare, put financial middlemen, Wall Street, private equity, venture capital right into the middle of Medicare where they have never been before. They've never been there before. This is new. It started under President Trump and it's rolling forward still today. And we frankly have to stop it if we want to protect Medicare. So go to protectmedicare.net.
Absolutely. Yeah, we never is a good thing for the health of people to put corporations in control of those choices. So thank you very, very much for all of this expert information, as well as these really great action steps people can take. Thank you for joining us today. And for everyone else, get out there, take action, and we will see you at our next MRCC Medicaid Minute.